Hello everyone! Welcome back to UWorld's Next Gen NCLEX Review. My name is Samantha and I am a nurse here at UWorld. I'm so excited to see you back. Today we have a special question drill for you all. We're going to be doing mental health questions. We get so many requests for mental health topics, so I really hope that we're able to provide this for you guys today, and for anyone that's previously requested this topic, that you're able to get your worth out of it and learn a little bit more about some important mental health topics. So a couple of things before we get started, a reminder to drop those answers in the chat. We have Nurse Jackie standing by, ready to moderate, ready to answer any questions that you may have. So drop in even if you're just going to say hi. And a reminder to drop any answers in to our questions that we have coming up. We have 8 questions for you all today. So with that being said, a reminder these also are posted afterwards to our YouTube and our Facebook channels. So if you miss a question or you need more explanation, you can always check back in there to get a little bit further explanation, to go back to a question that maybe was tricky for you. So let's go ahead and get started. Our first question is going to be, the nurse is reviewing telephone messages from clients. The nurse should first telephone the client who reports. Option 1, mild skin rash after starting lamotrigine. Option 2, decreased libido after increasing the sertraline dose. Option 3, dry mouth and constipation while taking olanzapine. And option 4, decreased appetite and insomnia while taking methylphenidates. Alrighty, so let us know what you guys are thinking. Drop your answers in the chat. And a reminder, if you haven't already, go ahead and follow us at UWorld Nursing. Whatever social media channel is your favorite, follow us there. We are so close to hitting 50,000 followers on a couple of our channels, Instagram, TikTok, and YouTube, I believe. So help us get there. We're really trying to get there before the end of the year. So give us that little push it takes to get there. We would appreciate it. And also a reminder, go ahead and share this live. If you have fellow nurses, fellow nursing students in your networks and your social networks, they could really benefit from this. So share away so that everyone gets a chance to learn more about mental health questions. Alrighty, so I'm going to go check the chat and see what we are all thinking. And I see a lot of option 1, which, good news, option 1 is our correct option. Way to go, you guys. So let's walk through this. I did see a couple 3s and 4s, so let's clarify. Option number 1, mild skin rash after starting lamotrigine. What is this hinting at? So the issue here is that we are worried in this client about something called Stevens-Johnson syndrome, or SJS. So this is an immune-mediated reaction. It's commonly triggered by certain classes of medication, including anticonvulsants. It could even be triggered by antibiotics. SJS is very serious and can cause fatal complications. It can cause things like sepsis and multiple organ dysfunction syndrome, or MODS, and it requires immediate hospitalization. So we are, again, asking who the first client we should telephone back, the first client we should call. We're going to call the client that's the highest acuity, that we're the most worried about. And in this case, we're the most worried about a client with potential for Stevens-Johnson syndrome. In options 2, 3, and 4, so these are all expected findings. Option 2, decreased libido after increasing the sertraline dose. We would expect this on an antidepressant. Option 3, dry mouth and constipation are expected findings with olanzapine. And lastly, 4, decreased appetite and insomnia when taking methylphenidate. Methylphenidate is Ritalin. This is for ADHD, and we typically see decreased appetite and issues with insomnia with this medication. So again, these are expected findings, and we would not first be calling any of these except for our option number 1, potential for Stevens-Johnson syndrome client. Alrighty, great job on that one. Moving on. So the nurse is observing staff members caring for a client who is experiencing delusions. The nurse should intervene if a staff member is observed. Option 1, distracting the client with music. Option 2, opening snack packages in front of the client. Option 3, debating the content of the delusions with the client. And 4, telling other staff members to avoid whispering near the client. Alrighty, let us know what you're thinking. Drop your answers in the chat. I just moved over a little bit, so I hope you all are able to better see the question behind me, but let me know in the chat if you aren't. We want to make sure that we are doing everything to make this viewing experience as easy as we possibly can for you guys. So thank you for letting us know. In the meantime, while you're dropping your answers in the chat, I see a couple already coming in. Let us know who here has already taken their NCLEX and passed, who here is planning to test maybe in the next few weeks, next few months. Let us know so we can either wish you good luck or we can congratulate you if you already passed. Regardless, that's so exciting. We're proud of you guys, and keep letting us know. We want to be as helpful as we can. We want to be a part of your nursing journey and your NCLEX journey. So let us know how we can best do that. Alrighty, I'm gonna go back to the chats. Oh, I see someone testing on November 22nd. That is coming up soon. Good luck. You're gonna do great. Stay calm and read every question and every option thoroughly. Make sure you know what it's asking. And I see another one on December 2nd. So good luck, you guys. We are rooting for you. Alrighty, so let's go ahead. I see a lot of option number 3, and that's spot on is indeed our correct option here. So again, this is an intervene question. We intervene when an action is contraindicated, when it's not safe, or in this case, when it's not appropriate and can be harmful to the client. So this client is experiencing delusions, and again, delusions are false beliefs the client strongly believes are true. And remember, delusions and hallucinations are separate things. Delusions cannot be changed by logic. These clients a lot of times will not respond to reason or trying to persuade them away from it. Even though the delusion itself is false, the anxiety they experience from the delusion is very, very real, and we want to be mindful of that. We want to use our therapeutic communication techniques. So we would intervene for option 3, debating the content of the delusions with the client. We want to ground them in reality, but we never want to debate. We never want to negate or do things like that. So again, option 3 is what we would intervene for. Therefore, it's our correct option. And a reminder that we should always prioritize this client's anxiety. Once the client is calm, the nurse should then consider minimizing conversation about the delusion and direct the client back to some reality-oriented activities. In the meantime, options 1, 2, and 4 are all things that we would indeed do. We would help to distract the client with music. We would open snack packages in front of them so they don't feel like we're hiding anything in the snack packages or do anything like that. And we're also making sure that other staff members are aware that whispering near the client who's actively experiencing delusions may be harmful and is not appropriate. So again, option 3 was our correct option. Way to go, you guys. Alrighty, so question number 3, we are flying through today. The nurse is assessing a client with serotonin syndrome. Which of the following findings would the nurse expect to observe? Select all that apply. So our options are diarrhea, myoclonus, lip smacking, hyperreflexia, and body tremors. So again, we're just asking what are the expected findings we would see in a client experiencing serotonin syndrome. Alrighty, so a reminder, we have an events page that lists out all of the content we plan to do for the next 3 weeks. To note, we are going to be taking a little break for Thanksgiving, so we're going to be taking that week off of lives, but before and after we'll be having our normal live content. So again, this events page will tell you Tuesday, Wednesday, and Thursday what we plan to address on those days, what topics we're going to be covering. So make sure you check out uworldnursing.com to see that full calendar, as well as plug in your email and your name so you can get emails right to your inbox that tell you what we plan to do for that week and any important, exciting UWorld news. So if you haven't visited uworldnursing.com, now is your chance to do it. Alrighty, I'm going to see what we're thinking in the chat. And I see a couple different combinations, but mostly I see the correct combination of answers, and that is going to be 1, 2, 4, and 5. So again, serotonin syndrome is what we are asking about here in this question. Serotonin syndrome, is essentially a state of serotonin toxicity. It's a life-threatening condition. It's caused by excess serotonin in the central nervous system. So this can occur when a client initiates serotonin in a medication they're taking, or maybe increases their dose of a serotogenic medication like an SSRI, or a selective serotonin reuptake inhibitor, or an SNRI, a selective norepinephrine reuptake inhibitor, or an MAOI can all cause this. So this can be a combination of things as well. So clinical manifestations that we'll see in serotonin syndrome include the things here. So diarrhea, myoclonus, hyperreflexia, body tremors. It includes things like altered mental status, which includes agitation, confusion, hallucinations. We can see autonomic systems like a high fever, hypertension or high blood pressure, as well as tachycardia. And we can also even see GI or gastrointestinal manifestations, so things like diarrhea, which is listed here, or a hyperactive bowel. So way to go, you guys. You did so well on that. To note, option 3 was not correct. This was our incorrect option. Lip smacking is a sign of tardive dyskinesia, which is a side effect of an antipsychotic medication, but it's not consistent with serotonin syndrome, so the nurse should not expect to observe this. Way to go, you guys. Let's go ahead and move on to our next question, question number 4, So the nurse is teaching the parent of an 8-year-old client with attention deficit hyperactivity disorder, or ADHD. Which of the following information should the nurse include? And again, a select all that apply question. Option 1 is minimize distractions while completing homework assignments. Option 2, decrease the number of breaks between activities. Option number 3 is collaborate with teachers to allow for extra time when taking tests. Option 4, provide a list of activities and goals for self-care. And option 5, use a sticker chart to encourage completion of household chores. Alrighty, so not only do we have a mental health question, but we also have a pediatric question. This is an 8-year-old client, so keep that in mind. I'll give you a chance to go ahead and drop your answers in the chat. Let us know what you're thinking. Let Nurse Jackie know what you're thinking. And just for reference, did anyone join us on Tuesday? We did an electrolyte imbalance live lecture session yesterday. We focused on potassium, which is kind of the MVP of electrolytes. We covered hyperkalemia as well as hypokalemia. So if you haven't checked that out yet, it will live on demand on our Facebook and our YouTube channels. So you can always hop back in. Electrolytes and electrolyte balance, fluid balance, things like that are kind of tricky concepts. I know I needed some more resources on that when I was in nursing school. So if you find yourself in the same boat, make sure you check that out. It was a good lecture, and I hope some of you joined. But again, we always do lecture sessions on Tuesdays at noon Central Standard Time. So if you didn't join us last week, join us next week. We're going to be doing chronic kidney disease. Alrighty, so I see lots of answers in the chat, and I see mostly correct combinations. So way to go, you guys. I see a couple here. Cami, you got it right, indeed. So 1, 3, 4, and 5 are going to be our correct options in this case. So again, the nurse is teaching the parent of an 8-year-old client, and these are going to be appropriate statements that sum up that this parent is understanding the plan of care, understanding what this client needs to be doing. So option number 1, minimize distractions while completing homework. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder. It's characterized by inattention, distractibility, and or it can have hyperactivity symptoms. So children here may be restless, they may have difficulty paying attention, they may be impulsive, they may talk excessively and have a tendency to interrupt others. So these are all things that we can see with ADHD. So in option 1, we will want to minimize distractions to keep them focused because they do have that difficulty focusing. We're going to want to, option 3, collaborate with teachers to allow for extra time. We're going to allow for accommodations for these children when they're taking tests, when they're taking standardized tests especially. So accommodations are something we will see in an ADHD client. Option number 4, setting goals and providing goals for them to accomplish is a really great way to get these children involved in their own plan of care. We always want to set goals with ADHD clients, so this indeed would be indicated. And lastly, we're using a sticker chart to encourage completion of household chores. Incentivization works really well for these pediatric ADHD clients. We want to incentivize them with things that are fun, like stickers and sticker charts, in order to help them get done their activities of daily living, their chores in this case. So again, option 5 is something we'd want to do. So options 1, 3, 4, and 5 were our correct options. Option 2 is incorrect because it says to decrease the number of breaks between activities. We would want to be allowing them lots of breaks within activities to allow them to get away, do something else, and then hopefully come back a little bit more focused and ready to pay attention. So we would want to increase the number of breaks, not decrease the number of breaks. But good job on that one. I see almost all correct options. Way to go, you guys. Alrighty, question number 5. We're more than halfway there. I hope you're sticking with me. So the nurse is caring for a client with panic disorder who is experiencing tachypnea, dizziness, and diaphoresis. Which of the following actions should the nurse take? Option 1, administer escitalopram to the client. Option 2, teach the client how to perform guided imagery. Option 3, instruct the client to take a deep breath and bear down. And option 4, stay with the client and communicate calmly and clearly. Alrighty, so let us know what you're thinking. Drop your answers in the chat. We have a nice little break from our select all that apply questions with this one, so only one correct option here. In the meantime, a reminder, we have a 7-day free trial available on uworld.com, or uworldnursing.com has a link to it as well. This is a great way to get in, get comfortable with our products, see all that we have to offer before you commit to purchasing. And if you are a very money-minded consumer, which I totally get, I was pinching all my pennies in nursing school, we now offer Affirm, which allows you to break them up into smaller monthly payments as low as $13 a month. So if the initial fee up front of UWorld is a little bit too much for you, no worries, you can break it up using Affirm into that payment of as low as $13 a month. Our motto for that is study now, pay later. So this is a great option in the case that upfront cost is just a little bit too much, but no worries there. Alrighty, so I'm going to check the chat and see what everyone is thinking. I see a 1 mixed in here. I see mostly 4s, and I see a couple of 3s. Oh, and I see a 2. So our correct option number 4. It looks like the majority of you guys got this. Way to go. But I'm still going to go ahead and explain it for anyone that wasn't quite understanding what this question was asking. So again, we're asking for the following actions that the nurse should take. So what is the intervention that is therapeutic, that is indicated for the client's condition? And in this case, the condition is panic disorder. So panic disorder is characterized by recurrent, typically brief episodes of panic, like sudden intense panic. They can be as short as like 5 to 30 minutes. The client will experience sudden intense anxiety and fear, as well as like a physiological discomfort. And this is sometimes the tricky thing about panic disorder is that the panic attacks that we see with panic disorder often occur unpredictably and without a notable trigger. So things here is that panic attacks can also, they resemble cardiac and respiratory conditions because it involves the activation of that sympathetic nervous system. I always mess that word up. So clients here can experience, again, those cardiac and those respiratory conditions because the feeling of that intense anxiety and the fear. So sometimes this will look like a lot of respiratory issues, a lot of cardiac issues as well. So option number 1, 2, and 3 were our incorrect options. Again, Escitalopram, this is not fast acting, so it's not something that we would want to give in the case of a panic disorder where this client is having an onset immediate panic attack. Option 3, teach the client how to perform guided imagery. In this case, when they're actively experiencing a panic attack, they're probably not going to be able to really focus on the guided imagery, so this is not going to be an intervention that's going to be very helpful for them. Option number 3 is instruct the client to take a deep breath and bear down. This is something called the vagal maneuver, which we typically do in cardiac conditions like SVT or supraventricular tachycardia. This is not super helpful for this client in this specific condition. And lastly, our correct option is always to stay with the client and communicate calmly and clearly. We want to give our presence, help to calm them down, and stay with them. That is our first intervention as nurses. It's also a therapeutic intervention just to have a presence with them, make sure we're keeping them calm and keeping them safe. So again, whenever we have a mental health concept, we always want to think about therapeutic communication and how we can best keep the client safe. Those are going to help you out when you're answering your mental health questions. Alrighty, moving on. Question number 6. We are flying through it today, you guys. So the nurse is observing a staff member caring for a client with generalized anxiety disorder. The nurse should intervene if the staff member is observed. Option 1, assisting the client to identify factors that contribute to symptoms of anxiety. Option 2, requesting a prescription for lithium to treat acute symptoms of anxiety. Option 3, encouraging the client to perform deep breathing exercises. And lastly, recommending that the client limit the intake of caffeine. Alrighty, what do you guys think? Let us know. Drop your answers in the chat. Again, we have another break from those select all that apply questions. I know today was a little heavy on select all that apply, but hopefully this select one answer is a little bit of a respite for you guys. Alrighty, so in the meantime, while I'm waiting for you guys to drop your answers in the chat, and I already see some great ones coming in, let us know, how are you guys studying? What are you using to study? Are you using UWorld? Are you using a combination of things? Are you finding other resources? It's so interesting for us to find out, to see where you are in your nursing school process, as well as where you are in your NCLEX studying process. So again, let us know how you all are studying. We're curious. We want to know more. Okie doke. So I see mostly correct options. So I'm going to go ahead and move on because you guys did so well on this one. Our correct option, you guys got it. It was option number 2. So let's walk through this. We are looking at generalized anxiety disorder. And again, we are asking for what should the nurse intervene? Meaning, what is the action that's not indicated, that's not safe for the client, that's not going to help? So this option number 2, requesting a prescription for lithium to treat acute symptoms of anxiety. Remember that lithium is a mood stabilizer, and we use it for acute manic episodes or in the treatment of maintenance of bipolar 1 disorder. The appropriate medications for a client with generalized anxiety disorder or anxiety are going to include our benzos, like our lorazepam, but it's not really going to include lithium. So this is why we would intervene, because it's an incorrect option. And again, options 1, 3, and 4 are things that we would encourage the client to do. Therefore, we would not need to intervene. But way to go, you guys. Great job. Alrighty, question number 7. The nurse is caring for a client with bipolar 1 disorder who is receiving lithium. So a little bit about what we just brushed on earlier. The nurse should recognize which of the following are risk factors for developing lithium toxicity. Select all that apply. Option 1, dehydration. Option 2, hyperkalemia. Option 3, hyponatremia. Option 4, hepatic cirrhosis. And option 5, acute kidney injury or AKI. Remember that hyperkalemia is high serum potassium and hyponatremia is low serum sodium. This is fortuitous because yesterday on Tuesday we did an electrolyte balance or electrolyte imbalance, should I say, live lecture session. We focused on potassium. We covered hyperkalemia as well as hypokalemia. So if you're interested in learning more about that, it is on our Facebook and our YouTube channel. We post all of our past lives to those channels. So go ahead and check it out if you want to learn more about electrolyte balance issues. And also, while I'm waiting for everyone to finish putting their answers in the chat, again, we have another select all that applies, so make sure you read through all of our options. Let us know what topics you want to see us do. We've gotten a lot of requests for mental health topics, and I hope that we are meeting that with this question drill that we're doing today. We've also gotten a lot of OB and pediatric specific topic requests. We've really tried to incorporate more of those into our schedule, but let us know if there's anything you haven't seen us do that you want us to cover. To note, we are covering ECG strips next week. So we've had requests for that too. We have taken it into consideration and we will be doing ECG strips next week, next Wednesday, I believe. So anyone interested in cardiac ECG strips, make sure you tune in next Wednesday at 2 and 3 p.m. Central Standard Time. Alrighty. Okay, so I see a mental health ask, elderly or geriatric. That's a great suggestion. Thank you so much. Alrighty, more prioritization questions. That we can definitely do that. Alrighty, so I'm going to go ahead and jump to our answer. Our correct options were 1, 3, and 5, and I see mostly correct options. It looks like a couple of you left off option number 3, but by and large, I see a lot of correct options, so way to go, you guys. So remember, we have bipolar 1 disorder and a client who is receiving lithium. So lithium, like we brushed on earlier, is indeed a mood stabilizer. It is used in the maintenance phase of treating bipolar 1 disorder. It has a very narrow therapeutic index. So what this means here is that we have to monitor it really closely to make sure we're not having a toxic buildup of lithium in this client system, because this could result in lithium toxicity. So again, the nurse should recognize which of the following are risk factors for developing lithium toxicity. Our risk factors or potential causes, we think lithium toxicity, we want to think about things like dehydration, hyponatremia and low sodium, and of course AKI or any problem that affects our kidneys and our ability to filter our blood and filter lithium out of it. So dehydration and hyponatremia trigger the release of antidiuretic hormone, which causes renal reabsorption of sodium, of water, and lithium. And this can lead to, of course, increased serum lithium levels, which would lead to lithium toxicity. So again, dehydration, hyponatremia, and AKI are going to be our correct options. Options 2 and 4 are not related. Option 2 may indicate kidney problems, but standalone hyperkalemia, not hyperkalemia that's specified as resulting from a kidney problem, would not be one of our signs or risk factors for lithium toxicity. So way to go, you guys. You did so well on that. Again, 1, 3, and 5 were our correct options. And let's go ahead and move on to our final question of the day. So the nurse has attended a staff education program about ketamine. Which of the following statements by the nurse would indicate a correct understanding of the program? Select all that apply. Another select all that apply. I'm sorry, you guys. So option 1, clients who are receiving ketamine may experience hallucinations. Option 2, bradycardia and hypotension are common adverse effects of ketamine. Option 3, nursing care should be clustered for clients who are receiving ketamine. Option 4, ketamine can be used to treat clients with treatment-resistant depression. And lastly, option number 5 is administering a selective serotonin reuptake inhibitor, or an SSRI, with ketamine can reduce adverse effects. Alrighty, let us know what you're thinking. Again, select all that apply. This is a longer question, so make sure you read through every option here fully. Alrighty, and in the meantime, a reminder, next week we will be live again at our normal times. We'll be live on Tuesday at 12 p.m. Central Standard Time with a chronic kidney disease lecture. I will be doing that, so make sure you stop by, say hi, learn a little bit more about the kidneys. On Wednesday, we're going to be doing an ECG strip question drill. We've had a lot of requests for this, so I really hope we're meeting that need. We will be live at 2 and 3 p.m. Central Standard Time on Wednesday. And Thursday, we will be back with Nurse and Coley for an oncology question question drill. And that, oh, excuse me, we're actually having a new nurse. It will be Nurse Brittany, who will be putting on our Thursday question drill. We'll be going to be covering oncology questions. So make sure you tune into that and welcome Nurse Brittany to our team. We are happy to have her. Alrighty, so I'm going to check our chat and see what everyone is thinking. Okay, so I see a mix here. Let's make sure we go through this one in full. So our correct options are going to be 1, 3, and 4. I see mostly 1, 3s, and 4s, but I see some 2s and 5 mixed in too. So again, ketamine is given for a couple of different reasons. In this question, a nurse is attending a staff education about ketamine. So we give ketamine for pain management. We give it for depression treatment, as well as even it can be used for sedation. So what it does is it binds to receptors in both the central and the peripheral nervous systems, including opioid receptors. So interesting enough here, it mimics the effect of opioids. This drug is highly lipid soluble. It penetrates that blood-brain barrier rapidly, which means we have a rapid onset of action with ketamine. That's a key thing to know about it. Alrighty, so what we see here is clients who are receiving ketamine may experience hallucinations. This was a correct option. Unfortunately, some of the adverse effects of ketamine can include disturbing psychomimetic effects, which include hallucinations. We can see this with ketamine. So this would indeed indicate a correct understanding of the program. Option 3, nursing care should be clustered for clients who are receiving ketamine. This is another nursing intervention we should be taking for these clients who are taking ketamine. Option 4, ketamine can be used to treat clients with treatment-resistant depression. This is indeed correct. We do use this for depression, specifically treatment-resistant depression, so we know this is correct. Options 2 and 5. So typically with ketamine, an interesting thing here is that there's a low incidence of reduction of our cardiovascular, respiratory, and bowel function. We don't see a lot of changes here. So it's not common for this to affect our cardiovascular system. So bradycardia and hypotension would not be common adverse effects. And lastly, option number 5, administering an SSRI with ketamine can reduce adverse effects. Again, this is incorrect. We do not give these two together. This would not be something that we would want this nurse to take away from this staff education program. So options 1, options 3, and 4 are our correct options. Way to go, you guys. You did so well. Let us know how many out of 8 you got correct today. I already see someone who got 6 out of 8 correct. That is amazing. Way to go, you guys. Alrighty, and just a quick little, we have something to show you here for anyone that's already on our UWorld product. In case that you are looking for more mental health questions, you want to practice a little bit more after today, which is wonderful. On our QBank, which is what this image is showing, we can show you here, go to the subject of mental health and the system of mental health concepts in order to get more mental health specific questions, test your knowledge, test what you learned today, or just simply get a little bit more practice on this beautiful Wednesday afternoon. Alrighty, so thank you so much. A reminder to come back tomorrow for our most missed question drill with Nurse Nkoli. Say hi to her, just stop in, stop by. Thanks again for joining. We're so excited to have you guys